Health Education Session 2, Understanding Diabetes and Preventing Complications. Welcome to our second and final health education session. Today, we're going to expand our understanding of diabetes by covering the basics, including types, causes, and symptoms. Additionally, we will talk about comprehensive strategies to prevent and manage diabetes-related complications. Diabetes affects how your body processes food into energy. Normally, when we eat, food is broken down into glucose or sugar and released into your bloodstream, which signals your pancreas to release insulin. Insulin is essential for allowing glucose to enter your cells for energy. Think of insulin as a key that opens the door for the sugar in your blood to get into your cells of your body for them to have energy. In people with diabetes, this system does not function properly, causing glucose to remain in the bloodstream and leading to high blood sugar levels, which can cause health issues over time. Diabetes is a chronic condition that can adversely affect multiple body systems. It can lead to serious health complications such as stroke, impacting the brain, vision impairment or blindness affecting the eyes, heart attacks involving the heart, kidney failure affecting the kidneys, and loss of sensation in the feet due to nerve damage. Early diagnosis is key and can be achieved through a blood test known as the hemoglobin A1C or A1C. This test measures the average blood sugar levels over the past 3 months, providing a comprehensive view of how well your blood sugar is being managed. An A1C level of 5.7% or lower is considered normal. Levels between 5.7% and 6.4% indicate prediabetes, and a reading of 6.5% or higher is a diagnosis for diabetes. For individuals with diabetes, maintaining an A1C below 7% is considered controlled diabetes. There are different types of diabetes. Type 1 diabetes. This is when the body does not make insulin. Managing this type of diabetes requires taking insulin every day. Type 2 diabetes. This is when the body does not produce enough insulin or does not use it effectively. It is often managed through lifestyle changes such as diet and exercise, along with medication. Gestational diabetes. This type can develop in some women during pregnancy and usually goes away after giving birth, though it increases the risk of developing type 2 diabetes later. The causes of diabetes vary by type and can include genetic factors, environmental influences, and lifestyle choices, such as lack of exercise and poor dietary habits. Poor dietary habits that contribute to diabetes include high consumption of processed foods, excessive intake of sugary drinks, frequent eating of high-fat fast foods, reliance on refined carbohydrates like white bread and pastas, and insufficient intake of fiber-rich foods like vegetables, fruits, and whole grains. Common symptoms of high blood sugar include increased thirst, frequent urination, increased hunger, fatigue, blurred vision, numbness or tingling in the feet or hands, sores that do not heal, and unexplained weight loss, although some individuals may experience no symptoms. Managing your diabetes effectively requires regular follow-up with your healthcare provider to monitor your A1C level. If your A1C is elevated, it is critical to adhere to a healthy diet, engage in daily physical activity such as walking, check your blood sugar daily before breakfast, maintain a blood sugar log sheet, and take all medications as prescribed by your doctor. Always consult with your doctor before stopping or starting any medication. It's essential to ask questions during your consultations to better understand your health condition and the steps necessary for managing your diabetes, as detailed in the information sheet provided. Our goal is to help you understand what diabetes is so you can better manage your health. Do you have any questions about the information on diabetes we've covered so far? Great. Now, let's talk practical strategies to prevent or delay the onset of diabetes-related complications. Managing your diabetes is key to preventing complications. Eating the right foods can help you control your blood sugar levels. Focus on a balanced diet rich in fruits, vegetables, lean proteins, whole grains, and dairy. Here's a simple guide to help you measure daily servings using your hands. Fruits. Aim for about 2 to 3 servings per day of low sugar options. One serving can be visualized as a small apple or the size of your fist. Examples include berries such as strawberries, blueberries, and raspberries, cherries, and apples. Vegetables. It's recommended to have 3 to 5 servings daily of low-starch vegetables. One serving is about the size of your closed fist. Examples include leafy greens such as spinach and kale, bell peppers, zucchini, and cucumber. Grains. Try to consume 3 to 5 servings per day of whole grains, where one serving is a slice of whole grain bread or half a cup of cooked whole grain pasta or brown rice, roughly the size of your palm. Other examples include quinoa, barley, and whole oats. Protein. Include 2 to 3 servings each day of lean protein. A serving of meat, fish, or poultry is the size of your palm, and a serving of nuts is a small handful. Good options include chicken breast, turkey, fish such as salmon and tuna, and plant-based proteins like lentils and chickpeas. Dairy. Aim for 2 to 3 servings per day of low-fat dairy. One serving is a cup of milk or yogurt, about the size of your fist. Choose options like skim milk, low-fat yogurt, or low-fat cheese. Regular physical activity is another vital aspect of diabetes management. It aids in blood sugar control, weight management, and stress reduction. Aim for at least 150 minutes of moderate aerobic activity, such as brisk walking, every week. To make it more manageable, consider breaking it down into about 30 minutes per day. If you find it difficult to allocate 30 minutes at once, you can divide the time into 2 15-minute sessions or 3 10-minute sessions throughout the day. Try to engage in physical activity on most days and avoid going more than 2 days without it. Additionally, everyday activities like gardening, vacuuming, and sweeping that make you break a sweat also count as physical activity. Hydration is also crucial for maintaining health, especially in managing diabetes. It's recommended to drink 48 to 64 ounces of water per day, increasing intake on warmer days to compensate for increased fluid loss. Additionally, it is important to limit sugary beverages, which can be a major source of excess calories. Reducing these can significantly aid in controlling your blood sugar levels and overall caloric intake. Adhering to your prescribed medications is crucial for diabetes management. Medications are tailored to your specific needs to help maintain stable blood sugar levels, reduce the risk of complications, and improve your overall quality of life. It is vital to take your medications exactly as prescribed by your healthcare provider and discuss any side effects or concerns you may have. This ensures that adjustments, if needed, are made promptly and effectively. Regular monitoring of your blood sugar levels is not just about checking numbers. It provides vital feedback on how well your diabetes management plan is working. It allows you to understand the impact of your dietary choices, physical activity, and medications on your blood sugar levels. This insight is essential for making informed decisions about any necessary adjustments to your diet, exercise, or medication. Additionally, keeping a log of your blood sugar readings can be incredibly helpful during appointments with your healthcare provider, offering a detailed picture of your diabetes control over time. Implementing these strategies can significantly impact your health and quality of life. Our goal is to help you understand and manage your diabetes effectively. Thank you for being part of the Diabetic Retinal Screening Study. We hope you found the health education sessions helpful. Please continue to follow up on your diabetes medical care with your providers.